Hi, I'm Dr. Scott Greenberg, and we're going to talk about examination and treatment of the shoulder. This will encompass rotator cuff injuries, labral injuries, and biceps tendinopathy. The first thing we're going to do is inspect the shoulder and look for any abnormalities around the AC joint. We're also going to check for the position of the scapula, which is the wing bone, because it's very important to make sure that the articulation or the joining between the scapula and the shoulder are in the proper place, because scapulothoracic dysfunction, or the scapula being moved in a wrong location, will affect the function of the shoulder and can also cause pain. So what we're going to do is we're just going to take him through some basic maneuvers. So we can check what's called internal rotation, and we can check external rotation, and we can check the flexion of the shoulder as well. And there's a different types of damage to the arm will give different types of findings on physical examination. This here is called speed sign, and this here is called Hawkins. Now we want to palpate, and palpation is really important because often MRI or ultrasound will not show everything that we need to find on palpation. Now granted, especially when we treat rotator cuff injuries, we will use our MRI findings in conjunction with physical examination to provide the best treatment. So let's say that we palpate here and his rotator cuff is tender, which it is because I can feel it. But if we just went upon the MRI findings and didn't physically examine the shoulder, we would miss that there's problems here at the coracohumeral ligament, and also problems at the inferior glenohumeral ligament, and then problems in the bicep tendon here. And most of the patients I see that have rotator cuff issues also have a hidden biceps problem that doesn't show up on ultrasound or on MRI. This is why it's so important in order to examine the shoulder properly. And then we want to examine the posterior rotator cuff and feel the muscles that attach to the back of the shoulder. Because often when people complain about shoulder pain, their problems they feel may be in the front, but there may be other anatomical issues in the back of the shoulder that help to stabilize the shoulder. And without treating that, you're not going to get the person all better.